Tēnā koutou katoa. I fear my talk may be a little bit less inspirational than Tepora's, but hard act to follow. But thank you so much for having me here today. So ESR provides national acute respiratory illness surveillance on behalf of the Ministry of Health and now the Public Health Agency, which sits within the Ministry of Health. And in this talk, I'm going to be covering ESR's roles in this space, touching on some of the qualities of an effective public health surveillance system, and speaking about where we are now and where we're going in terms of public health agency funded acute respiratory illness surveillance. And so this is just to describe ESR's roles in this space and to highlight that we have multiple interdisciplinary teams of scientists that work in designing, managing and delivering various acute respiratory illness surveillance systems in New Zealand on behalf of the Public Health Agency. And since the arrival of COVID-19, we also assist the Public Health Agency in leading COVID-19 surveillance activities. And in that respect, I won't be speaking to some aspects of that work, for example, COVID surveillance strategy work and reporting that they do. But COVID-19 pandemic and the health reforms have brought big opportunities for national surveillance and research, and we are really in a time of big change. So in addition to our national role, we also support intelligence for WHO-led and regional surveillance activities. So for example, we're partners in the Pacific Public Health Surveillance Network, and of course, as we know through this day-to-day, there's lots of collaborations in research activities as well. And I sit on the SHIVERS-I primary care advisory group as well, as an example. So those academic service provider relationships are really important for our surveillance system development as well. And so just a brief reminder of some of the key qualities of an effective public health surveillance system. So the CDC described 9 system attributes, and then an overall assessment of usefulness, that is, how well does the system respond to the purposes for which it was established? And in the context of New Zealand and internationally, a big aspect of that is how well we can detect and respond to health inequities. In New Zealand, we want to be able to detect, describe, understand acute respiratory illnesses, and in particular influenza, COVID-19, RSV, and new and emerging disease threats, as well as monitoring how we are responding to those issues as well. And so I'll take you through the layers of our surveillance system that the Public Health Agency funds us to manage, and some examples of their roles through the pandemic years we are in, and some of the ESR development activities in this area. And in 2020, we established the Acute Respiratory Illness Surveillance Development Project. So starting at the top, we have, of course, our Sentinel Severe Acute Respiratory Illness Surveillance in the Auckland region. And this has really proved itself to be a really key, stable surveillance system through the pandemic and peacetime. It's able to provide consistent syndromic information, as well, of course, as information on incidence and disease trends, and particularly for those non-notifiable diseases, it's been exceedingly important. It's been described very well, the breadth of information it gives us, including the impact of public health interventions by Sue already today. Some of the key limitations are that it's a quite resource-intensive system and that its representativeness is currently limited to the Auckland region. So, as part of the acute respiratory illness surveillance development work, we were looking at a potential role for electronic health record inpatient data for surveillance, and in collaboration with Te Whatu Ora, Counties Manukau, if we evaluate that against the gold standard, it could be a potential useful surveillance methodology to apply to other regions. So that project is currently still in planning phase. And this is just a quick news flash about the new online acute respiratory illness surveillance dashboard, which has just been updated. So if you want some more details on the intelligence that we're deriving from these systems, then that's a good place to find it on the ESR web page. And along the top, there's different tabs that you can delve into more detail for specific system information. And next, so of course, in 2020, we worked with the Ministry of Health in establishing COVID-19 notifiable disease surveillance, which is the most appropriate type of system for such a significant emerging event. And it's particularly useful when you have a need for new real-time case intelligence to be connected closely to public health action. When I spoke at one of our workshops last year, it's also important to recognise that with an increasingly prevalent disease, particularly in a community where reporting becomes increasingly biased, and where there isn't necessarily that close coupling between notifiable disease surveillance, that there's a focus on other types of surveillance as well. So multiple systems were established through the COVID response, sometimes led by IT infrastructural needs to solve a particular solution, and there does need to be a public health lens over that, public health leadership and evaluations of what's working for New Zealand, absolutely. And integrated COVID-19 and SARS-CoV-2 sentinel surveillance is a really key component of that. Of course, we established whole genome sequencing of SARS-CoV-2 and integrated that with COVID-19 surveillance, and that has been really critical to multiple decisions through the response, and that was initiated by a research grant in 2020. One of the intelligence outputs, and a really good example of an effective academic and CRI service provider collaboration, has been the COVID Genomics Insight Report, and there's a picture of one of the front pages on the left of the screen. And that has been able to provide early intelligence to decision makers about national trends, emerging science and its implications. On the right-hand side is a reminder of the importance of our roles in international surveillance. We also support other countries in their intelligence. For example, we do some genome sequencing for the Pacific Islands. And Joep de Licht and I are involved in the Western Pacific region's WHO impact system, which is about integrating traditional epidemiological surveillance methodologies with emerging technologies in genome sequencing in order for us to be able to respond to whatever's next coming down the pike. And a clear national test results repository has been really important for monitoring, for example, equity of access to testing of SARS-CoV-2, and the plan is to expand that, hopefully, to other respiratory pathogens. Sentinel GP-ILI surveillance, unfortunately, proved itself to be a bit inflexible during the pandemic response due to the huge demand on general practice and the change in testing patterns to go to community testing centres, and as such we had to remove the syndromic component of that and just rely on virological sampling. So there's a big focus on the development work to improve that system. Priorities in this year include recruitment, making sure that we can try and recouple the syndromic surveillance aspect of that work as well, and attempt to unify systems for reporting so that it can be deployed to CTC in a potential future response. And this is just a reminder of the GISRIS Plus objectives that they recommend for sentinel surveillance of influenza and COVID-19. I won't go into that much. Nick covered off some of those objectives really, really nicely. And then, of course, COVID-19 wastewater surveillance had a key role through the pandemic as well, and there are likely to be further developments in that this year around genome sequencing and ongoing modelling work. And there's syndromic surveillance. So first of all, our acute respiratory illness and ILI outbreak surveillance is under evaluation this year, which is great. It had a role in enhanced event-based surveillance at the start of the year, but it has high variation in terms of how it's operating. So that's an evaluation in progress currently. HealthStat GP consultations, ILI monitoring was a really important aspect of our surveillance system through the pandemic, and that is we expanded it from about 70 practices up to 300 to get better representative, focusing on particularly expansion to practices that had Thai, Pacific and Maori, and that is also a system that we rely on. We're also though doing a pilot with Datacraft, which we hope to evaluate against HealthStat to see if that's a potential alternative as well, which is of course a text mining platform. Oh, sorry. And finally, flu tracking, just to note that we've taken that over from the Ministry of Health and Public Health Agency this year, and hopefully we're hoping to develop surveillance in that space as well. So finally, some of our focus this year is around intelligence development and communication and how we disseminate that. One aspect of that is ESR Intelligence Hub, so it's easier to find information fast. And of course, I've touched on some of these activities already. An important one, though, to note is we're hoping to find out how well the research activity in the GP-RE surveillance space that was done for SHIVERS-I performed as a potential way to be useful for our national surveillance. And so just a big thank you to the many people. These are just some of the names that are involved in ESR and other agencies in this space. So, no reira, tēnā koutou katoa.